the Delta variant was expected to be confirmed in the Philippines as the dominant variant circulating, as it has done in more than 163 other countries. We know that the Delta variant, because of its higher transmissibility, will replace be it the wild type or the other variants of concern. And so what we are seeing here in the Philippines is not unique. That's been seen in many other countries. Minimizing the impact of the ongoing pandemic can only happen if each of us individually, each of us as families, each of us as barangays, as local government units, as cities, as provinces, as regions, come together to work together to minimize the impact of this pandemic. This is not something that your local government, your health department, your regional IATF or provincial IATF can do on their own. It is something where we need to come together. We need to work together. Whatever our beliefs, whatever our challenges, whatever the stresses we are going through, it's been a very long journey. Many of you are tired, many of you are stressed. I could attest to that. It's been a long journey. I myself, my family is also stressed. We have been working under pressure for many months now, but it's now that we need to come together. We need to see how we can come together to minimize the impact of this current surge, not only from a health perspective, but also from an economic perspective. So aligned to that, I'd like to talk on 3 key areas that we believe will help to further strengthen the response. The first area that I'd like to touch on is vaccinations. We have looked at local data in the National Capital Region, in the regions of the Philippines, where we see that those developing severe disease are largely, sometimes above 90%, are unvaccinated. Those that are dying, more than 95% are unvaccinated. So the narrative that vaccines are effective in preventing severe disease and death is still largely correct. And that is why we are advocating for those people at risk, and I reiterate, those people at risk, particularly the elderly and the comorbid, to avail of the vaccines as early as possible. There are vaccines, adequate vaccines in every region of the country. You need to accept those vaccines. It's not about protection of you from severe disease and death. It's about protection of the economy of your family. It's about protection of the economy of the country, because you are more likely to get severe disease. You are more likely to go into hospital for extended periods, and we can prevent that if the more at-risk people accept their vaccines. What we are seeing in regions like NCR, where the proportion of vaccinated people are higher, is that we are seeing less severe disease, we are seeing less deaths, and less case fatality rates. That is because the vaccines work. My message to you today as individuals, if you are elderly, if you have comorbidities, to you today, if your parents, your guardians are in these categories and have not accepted vaccines yet, if you are a local government executive or chief executive in the local government areas, ensure that your elderly, your comorbid populations are actually vaccinated. The full benefit of the vaccination is if we prioritize those groups. We know that about 70% of people who develop severe disease are in the above 60 age group. So we can prevent that, and if we prevent that, we prevent the overwhelming of the healthcare system by priority vaccination of the elderly and the comorbid groups. So let us do that. Let us create avenues so that we can vaccinate these people, because we know that younger people who develop the disease, they are at lower risk. They don't need to occupy hospitals. They don't need to occupy health system, intensive care units. And this way we will protect our healthcare workers, we will protect our healthcare systems from being overburdened. And if we can do this, we can keep our economy open. Whether it's at micro level or macro level, our economy can continue to function in the midst of the pandemic, so long as the healthcare system does not crumble under the number of patients who are needing intensive care or developing critical disease. To do that at an individual, at a family, at a local government level, we need to access the vaccines as a priority for the elderly and the comorbid populations. Let us continue to do that as quickly as possible, because when we have large numbers of elderly and comorbid populations vaccinated, we reduce the number of severe and critical cases, we reduce the burden on the health system. My second plea to you today is we need to rise up now, even though we are tired, by following the minimum public health standards. Although we don't like to physically distance, although we find it difficult to avoid crowded and closed settings, although we don't like the fact that we can't get together as families or groups of friends or work groups, that is what we continue to need to do, because we are faced with a more transmissible variant, a variant that can transmit easier, can affect everybody. And so it is incumbent upon all of us as individuals to follow the minimum public health standards, be that frequent hand hygiene, be that wearing of masks, be that physical distancing, be that having good ventilation where we are, be it avoiding the 3 C's. We need to do everything. We tend to always say we need larger lockdowns, we need ECQ, we need more stringent lockdowns. No, we need to recognize what I would say and practice a voluntary ECQ. Let's follow the minimum public health standards. Let's not go out if it's not absolutely necessary, whatever the quarantine level that is in your area. Let us shift to using digital platforms wherever feasible, whether it's to get together as families, as friends, for work engagements. If we start doing that, if we prevent for a short time more coming together till we have overcome this current surge, we can beat this surge. My plea to you today is, let us come together. We can, and we have full confidence that masking, physical distancing, hand hygiene, good ventilation, avoiding of 3 C's are still effective against the Delta variant, and we can prevent transmission. So let's do that. Let's try to break the chains of transmission. If we do that at an individual, family, community level, we minimize the impact. And my final plea to you is, as more and more people are getting infected because of the higher transmissibility of the Delta variant, because of the higher viral loads of the Delta variant, more and more people will get infected. And as more and more people get infected, more and more people will require hospital services, and the system will come under pressure. So, because we don't know whether this is even yesterday's number is the highest number, it could predictably still be higher in the next few days. And as more and more cases are confirmed, we expect more and more patients who will require hospital admissions. So my plea to you today is that if you are young, if you don't have comorbidities, if you're not at risk, you don't need to go and occupy a hospital bed. Monitor the symptoms. The DOH, the PhilHealth, the WHO have all issued home care management guidelines. If you fit those criteria, try to isolate at home. If you can't isolate at home because you have congested home situations, because you don't have enough room, make use of isolation and quarantine facilities. Go to TTMFs. Don't go to a hospital. It's incumbent upon you as a member of the community to do what you can so that we reserve the space in the hospitals for those who really need it. For those who develop severe disease because of their comorbidities, because of their age, if we do this, we can prevent the overwhelming of the healthcare system. We can prevent an overwhelming of the hospitals. We can prevent the healthcare workers from being exhausted, and they will then be able to save more lives. So let us come together and do our bit, not just by practicing what we need to practice, but also rationalizing how we manage ourselves if we get infections. Because we know that young people who have no comorbidities are at minimum risk of developing severe disease. So let's use that knowledge, let's use the experience we've gained globally and in the Philippines to help decongest and manage the healthcare facilities. If your healthcare workers are saying you need to go into hospital, please go into hospital. If your healthcare workers are saying you're good enough to go into a step-down facility, please oblige. Don't stay put in a hospital, because those beds are needed for severe cases. If we can do that, we will come together as a community. We will be able to overcome this challenge. So these are my 3 key messages to you as we work to improve what is being done, as we work to see how we can better manage this situation, as we work to save more lives, and as we work to bring back the economic recovery as quickly as possible. This is not something that can be done by pointing fingers, blaming other people. It becomes incumbent upon all of us to do what we can now so that we contribute to that effort. And it is now that we need to come together. Thank you.